Yeah, super interesting. So it's not like there's one gene that they've identified, right? It's more
Mhm.
like a compilation of how different genes interact. I would think, right?
And women with PCOS can actually have different root causes. So this is where we can get into more of like the integrative or functional approach. So what is that trigger, right? What's that? I always picture a light switch to me. So if that gene gets turned on, like who's turning on the light?
Mhm.
So there's these various root causes. So I'll go through a few of them.
Well, hello, everybody, and welcome. Happy to see you today. Happy Thursday. And I've got a really great show lined up for you today. I'm really very excited. Today, we are going to talk with Eleni from Women's Nutrition Clinic. And today, we're going to talk a little bit more about actually a clinical topic that I think you're going to be really interested in, and that is PCOS. All right. So Eleni is really an expert in this particular area. So today is all about understanding your clients with PCOS, and we'll be talking specifically about just PCOS and must know information as a health professional. And really specifically, we're going to be delving into more of the functional and integrative approach to helping your clients with PCOS. So I think you are going to find it fascinating, especially because it's a very complex disease state, right? So so Eleni, welcome. Really so happy to have you here with me today. It's always so much fun to reconnect with you, and
Yeah.
thrilled to see you, your success. So welcome. Let's kick things off. I'd love just to hear a little bit about your backstory. What led you to down this path in specializing with in helping women with PCOS.
Yeah, thank you first for just having me here. Like, it's so great to reconnect. You've really supported me throughout the years, and helping me help more women as well. So I appreciate that.
Yeah, awesome.
So when it comes to PCOS, polycystic ovarian syndrome, the reason I'm really passionate about it is because I had personally struggled with it years ago before it got a little, I won't say it's mainstream, but you can find more resources on it now. I think there are more dietitians and health providers individualizing in it. However, I was really struggling. So I was at the doctor's office. I was put on 5 different medications at one point. I felt awful. Mental health, physical health was really declining. And it felt really odd to me that growing up in a fairly healthy household, fairly holistic, that I was being given only medications and not really getting to the root cause. So at that point, I was also early on in my college career to be a dietitian. So kind of ironic. I was going through this health crisis while also furthering my education and a health career. But I was able to use that to understand that the body is complex. There's more we can do than just medication. Sometimes medications obviously can be appropriate for disease states. And so throughout quite a long journey, I was able to eventually reverse my PCOS, manage a lot of the symptoms, keep my body out of an inflamed state. And it only felt natural to me that once I became a dietitian, exposed to functional integrative healthcare, to specialize in this, because I do believe I can come from a very empathetic place and understand what women are going through, especially on an emotional level. I get it. And having actually the scientific background and the education. I'm not just a coach saying, do exactly what I did to fix my body. I'm coming with a full set of tools, clinical tools as well. So that's bit about the journey and why Women Nutrition Clinic exists. And I also just work with women that want to feel better and enjoy their day-to-day life a little bit more. So it's really fun what I get to do every day.
Yeah, that's amazing. Yeah, and isn't it interesting how, many of us start on a path and it's based on our life experience. Quite often that really has a huge influence on the areas that we decide to delve into. Certainly in your case, right?
Yeah, absolutely.
So, all right. So you were diagnosed with PCOS while you were in school. And really the only solution was, here you go, here's your 5 prescriptions.
It was insane. Yeah. Metformin, spironolactone, birth control, thyroid medication, anxiety medication. Everything was just off, and the medication made things worse for me in my situation. So it was crazy time. Yeah.
Okay. So, all right. Well, for our audience, let's talk a little bit about, what exactly is it? It's very complex. Why don't you talk to us a little bit about, the definition and what it looks like in clinical practice?
Yeah. So as I will refer to it as PCOS, but again, it's polycystic ovarian syndrome. But not every female presents with ovarian cysts. However, to be diagnosed with PCOS, you do have to meet 2 out of the 3 diagnostic criteria. So this can be androgen excess, this can be the polycystic ovaries, or this can be ovulatory dysfunction. So changes in the menstrual cycle specifically. And it is the most common endocrine disorder among women of childbearing years. It's often confused as a reproductive disorder because a lot of women find out about it through infertility, but it's not just a reproductive issue. Okay. What's really fascinating about PCOS is there is a genetic component. And I do believe that we're seeing a rise in PCOS. And that's why I really want to share about it today, because numbers are going up. And it's because genes are being turned on. It's a very complex pathway. We're not exactly sure just yet, but we can look at our environment as a big driver, right? So that whole topic of epigenetics, why are these genes getting turned on in these women? So we can have this predisposition. It doesn't mean you're destined for PCOS. If your mother has PCOS, it doesn't mean you're going to have it. But if any female or patient has PCOS, it is important to look at, hey, did your mom have PCOS? Did an aunt have it? Did they have a metabolic condition that triggered it? So I think that's really fascinating that there is this underlying component.
Yeah, a lot of this does go back to genetics.
Oh, yeah.
And epigenetics in particular, right? Like which of those genes are being expressed more prominently than others. Yeah, super interesting. So it's not like there's one gene that they've identified, right? It's more like a compilation of how different genes interact, I would think, right?
And women with PCOS can actually have different root causes. So this is where we can get into more of like the integrative or functional approach. So what is that trigger, right? What's that? I always picture a light switch to me. So if that gene gets turned on, like who's turning on the light? So there's these various root causes. So I'll go through a few of them. One is inflammation, right? So if we live in an inflammatory environment, or we have inflammation in our body, if we have a chronic gut issue, if we have another autoimmune condition, if there's something that keeps bombarding our system, that can help turn that switch on. Insulin resistant. We see a lot of women with insulin resistance, but that's, I would say, the more like typical PCOS that a lot of providers might be used to seeing, but that's not necessarily for everybody. So what's contributing to that? It could be a high carbohydrate diet, or the standard American diet, the SAD diet, right? That's contributing to that insulin resistance, turning that on. Some sort of adrenal related issue. So stress. This is where we see a lot of women with lean PCOS. So a lot of women that aren't overweight, they're getting the diagnosis. They don't have that insulin resistant state. Well, are their systems just overloaded? Are they super stressed? Are they the modern day female, right? Working really hard, maybe a mom, not getting that self-care time in, and even birth control. So women that had completely normal cycles prior, their hormones were regulated, and then they were on the pill, they're getting off of it. And that could have triggered something, because birth control can trigger changes in blood sugar and even insulin states. So hope that makes sense.
It does. I would imagine that, especially with women that don't have a weight issue, I'm wondering, like, how is it not until they try to become pregnant? What is the trigger for the diagnosis? Right.
Usually what I've seen is that. So women, fairly healthy weight, fairly, good health history. And then they say, hey, I've been on the pill 10 to 15 years and now I'm off of it. I'm trying to get pregnant. It's not working. I've gained a little bit of weight at this point. It's just kind of stubborn. So that can definitely be a trigger as more women are on the pill. There's no shame about that at all. We just have to know that it completely shuts down that connection, right, between our brain to our reproductive system. The pill can disrupt the gut microbiome. So if you have this genetic predisposition, something like that can trigger it. Women with PCOS are more susceptible to gut dysbiosis too, which I also find fascinating. So I think everything can kind of work together. So I do see that quite a bit. But then I also see women who have said, hey, my cycles have always been irregular. I've always been a little overweight. And then after years of not really addressing the core, it just kind of explodes. And then the symptoms get worse too.
Okay. Okay. Interesting. So if I'm just a lay person, like when would I start to suspect
PCOS?
In terms of the most common symptoms, like what would trigger me to go to my doctor?
Yeah. So some of the most common symptoms we see with PCOS, weight gain can be one, but I said, it's not for everybody. But excess hair growth in unwanted places. Some women of certain backgrounds, I'm Greek and Italian, like you might have a little hair, but it's pretty obvious. Like if there's excess hair growth, if you're having to shave, pluck, wax, it's growing back worse, especially in hormonal areas of the body, like the jawline, above the lip, the chest, the back. These are areas that a lot of women complain of that excess hair growth. This is because of that high androgen state, the higher testosterone levels. Acne, adult acne can be a big sign if somebody has PCOS. Hair loss, gut issues, if there's some sort of inflammatory marker that's presenting on labs, blood sugar dysregulation, insulin dysregulation. So these are like a few. So it's more about like some of the main symptoms. But then if there's even some standard labs that somebody has drawn, especially blood sugar and insulin or testosterone, that's a nice starting point too.
Okay. So as a health professional, we've got lots of health pros watching today, big variety of different types of health professionals. Why is it important? Let's say someone doesn't necessarily specialize in PCOS. Why is it important to have a really good knowledge base around identifying clients with PCOS and just kind of having a handle on what to do about it?
Yeah, I think this is really important and why I was excited to share, because like I said, the numbers are on the rise, like infertility numbers, metabolic sort of imbalances. And it's important because it can really support a female in truly managing these symptoms. It can take effort, but these symptoms can be managed versus somebody having to struggle, be on medications, deal with symptoms, infertility, anxiety longer term. So I think as a clinician, just looking for, when you're speaking to your client, like, are their menstrual cycles irregular? If that's appropriate in their health history to ask. If they've been irregular, for how long? Do they notice excess hair growth in unwanted places? Are they dealing with acne, hair loss? Have they tried every diet, but they can't lose weight? Those are like telltale signs or questions you can ask about if and when appropriate, to help a female get the appropriate care. Because again, these symptoms can be managed long-term. You don't have to be like a victim to your PCOS, because it's incredibly debilitating physically and emotionally for women. And I think if we can work together and give the women just a little bit of relief, it goes a long way for the quality of their life.